Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're following me right now, I'm an Aspie. I'm all about creating mental health and awareness versus sharing my life stories with Aspergers Syndrome, OCD and the like, just to give you the lowdown what life is like for me as an autistic or an Aspie, as many people will know. Basically, I love the term Aspie more than autistic, but as again, this is just each to their own. Of the ones that you may meet and greet along the way of people that are autistic, that they have their variation of what they like to be called, of these kind of terms that has come out and about. I also do some tips and advice along the way with your personal struggles, regardless what they may be, of your mental health disorders or just any other personal health conditions that may come of reach, available to you hopefully on this channel as much as I can, as well as many other everyday topics that I may bring out, regardless if they're tag videos versus your challenges videos, some fun and exciting things along the way, hopefully just to take you down with me, just to share my life story, or just taking you all on a journey with me, regardless where I may be it outside or indoors in this full screen, as you can see here, and whatever else it may be. It has been brought to my attention while I've been meditating and thinking what to bring with you all about some personal stuff that I've been meditating on, regardless what they are, from my Beauty from Ashes playlistings or just the main playlistings of my, Autism and Aspergers Syndrome Help Central kind of playlistings, that at the moment I'm hoping to try and jazz it up a bit by giving you different parts of the deal of the videos of what I feel is right for me to share with you all, regardless what it may be, and hopefully along the way we'll learn something along the way together, regardless what it may be. So this one, obviously, as I was thinking about it, is obviously autistic related yet again, obviously, because as you know, most of this channel was supposed to be based on the autism related topics, but now I've just branched it out a bit more so that hopefully maybe it can be readily available of whatever other topics out there that you want to know about, that is health and awareness versus just health related topics, because that's where my passion lies, helping you all with that as much as I can. So this one's about basically the differences in the way of autism and Tourette's syndrome, or Tourette's for short. I know a few people that I've been talking to right now that does suffer Tourette's, and I'm hoping today, while you're asking, what it is there a link between, autism and Tourette's? How do they relate to one another? And many other questions you may be thinking and asking to yourself, or maybe you want to ask out loud to me, basically. So I'm here today to hopefully, despite the people's belief system or thinking patterns about Tourette's, and autism is the same, I want to obviously clear it up a bit, because obviously of the misunderstandings and misgivings, to make sense of it all, to have a better understanding, basically, and hopefully when this you'll learn something, as I said. Also, just to bear in mind, even though Tourette's syndrome was basically going to be a separate video, I will apologize to you all, but if you want this as a separate video, please comment below, and I'm hoping to make it as short and brief as possible, but I will apologize if it's not going to be in advance. And just to put a disclaimer, as always, I'm no medical professional, I'm just your normal everyday Joe blogs, and obviously with these advice that I give you of some tips and advice, regardless of how to manage these, if you hear any, just to be considerate, because they worked for me. Obviously, I know it may not work for you, but maybe you could try them once in a while, of these tips and advice that I share with you all, of the steps of managing your everyday personal, disorders, of whatever you're going through, or even just give and take. I take away something that maybe you guys have learned if you've been listing them in the comments. It's all about respecting one another's differences, regardless what it may be. So let's begin this before I run out of time. So as we are questioning what it is Tourette's syndrome, or Tourette's. Tourette's is an inherited neurological kind of, spectrum disorder that is usually on the onset during childhood, which is characterized by the presence of multiple physical motor tics and at least one vocal tic. You may see some people that may swear and cuss out of the ordinary and whatnot, and you tend to think, what the hell is going on, and you may give them the weird stare, but it's also got to approach with care in this, however. So hopefully, maybe if you want, I'll see what I can do in finding some information about how to approach someone with Tourette's in the right appropriate manner, so that you can, be well aware that it is actually, existent like many other things. But just to be in mind though, however, these tics can be characteristically wax and wane. However, this is a comorbid disorder with ASD or autism spectrum disorders such as autism and Aspergers Syndrome. Tourette's is now defined as a part of a spectrum of tic disorders, which includes transient and chronic tics. It could also be called Tourette's syndrome, Tourette's disorder, Gilles-de la Tour syndrome, DTS, or the more common, obviously, is now commonly called Tourette's. This was once considered a rare and bizarre syndrome, most often associated with the exclamation of obscene words or socially inappropriate and derogatory remarks, pretty much of certain words that comes out of their mouth. Like I said, that sometimes some may swear, cuss, some may just say words when they know they realise a tic is coming on, and force of habit will come up to play. Tourette's was once, obviously, with this symptom, is present in only a small minority of people, with Tourette's. It's no longer considered as a rare condition, however, but it may not always be correctly identified, because most cases are classified as mild cases today than ever before. Since the incidence may have been as high as 100% of 1 in 100 people, up to 530,000 US school-aged children may have Tourette's, with more common tics of eye blinking, coughing, throat clearing, sniffing, and facial movement. So bear in mind, some of these statistics also will be US, like United States or United Kingdom kind of statistics. So I humbly apologise. While I've been researching, trying to find some that is based on New Zealand, where I'm at. People with Tourette's have normal life expectancy and intelligence. However, the severity of the tics decreases for most children as they pass through adolescence, and extreme Tourette's in adulthood can be a rarity. Notable individuals with Tourette's, however, are found in all walks of life. They have been thought that genetic and environmental factors each play a role in the etiology of Tourette's, but the exact causes of this is, however, unknown. In most cases, medication is unnecessary to be used. There is no effective medication for every case of tics, but there are medications and therapies that may be able of help when their use is warranted. Explanation and reassurance alone are often sufficient treatment. Education is an important part of any treatment plan that is readily available, however. Basically, the characteristics of Tourette's syndrome: tics are sudden, repetitive, stereotyped, non-rhythmic, involuntary movements, and utterances that involve discrete muscle groups. Motor tics are movement-based tics, while vocal tics are involuntary sounds produced by moving air through the nose, mouth, or throat. The most typical age of onset is from 5 to 7. The ages of highest tic severity are 8 to 12, average 10 years old, with tics steadily declining for most patients as they pass through their years of adolescence. The most common first presenting tics are eye blinking, facial movements, sniffing, and throat clearing. Initial tics present most frequently in the midline body regions where there are many muscles, usually the head, neck, and facial region. This can be contrasted with the stereotype movements of other disorders such as DIMS and stereotypes of the ASD or Autism Spectrum disorders, which typically have an earlier age of onset, are more symmetrical, rhythmical, and bilateral, and involve the extremities, such as, the common one, flapping of the hands. Tics that appear early in the course of the condition are frequently confused with other conditions such as allergies, asthma, and vision problems. Unlike tics in the other disorders, the tics of Tourette's are temporally suppressible and preceded by a premonitory urge. Immediately preceding tic onset, most individuals with Tourette's are aware of an urge that is similar to the need to sneeze or to scratch an itch that is on their skin. Individuals may describe the need to tic as a build-up of tension which they consciously choose to release as if they've had to do it. Children may be less aware of the premonitory urge associated with tics than are adults, but there are awareness that tends to increase with maturity and enough age. Got to be in mind though, however, with this, they are obviously, known for the presence of multiple tics that can be physical or an audible tic, as I just mentioned, motor and audio tics. Need one of these to have this disorder. Basically, this does, however, work with Aspergers Syndrome. However, you could have one or more of these, just to bear in mind. So, as I said before, for the causes, if you want to know about the causes of Tourette's syndrome, as we know, it's unknown, but it is well established that both genetic and environmental factors may be involved in this. Genetical studies have been proven that the overwhelming majority of cases of Tourette's are inherited, although the exact mode of inheritance is not yet known, as well as there is no gene that has been identified. Non-genetic environmental, infectious or psychosocial factors, while not causing Tourette's, can influence its severity. Autoimmune processes may affect the tic onset and exacerbation in some cases. Diagnosis of Tourette's syndrome. According to the 4th edition of the Diagnostic and Statistic Manual of Mental Disorders or for Tourette's disorder, or DSM-4-TR, may be diagnosed when a person exhibits both multiple or one or more of the vocal tics, although these do not need to be concurrent over the period of a year, with no more than 3 consecutive tic-free months. However, previous editions of the DSM has included a requirement for marked distress or significant impairment in social, occupational, or other important areas of functioning. But this requirement was removed in the most recent update of the manual in recognition that clinicians see their patients who meet all the other criteria for Tourette's, but do not have the distress or impairments, however. Treatment for Tourette's syndrome. Obviously, this focuses on identifying and helping the individual manage the most troubling or impairing symptoms that does coexist into this. Most cases of Tourette's are mild and do not require pharmacological treatment. Instead, psychobehavioral therapy, education, and reassurance may be sufficient. Sometimes relaxation techniques such as exercise, yoga, or meditation may be useful in some of these situations to relieve the stress that may aggravate the tics, but the majority of behavioral interventions such as relaxation training and biofeedback, with the exception of habit reversal, have not been systematically evaluated and are not empirically supported therapies for Tourette's. Educating a patient, family, and surrounding communities, such as your friends, school, church members, or whoever, is a key for this treatment strategy. Treatments, where warranted, can be divided into those target tics and comorbid conditions, which, when present, are often a larger source of impairment than the tics themselves. Not all people with tics, however, have comorbid conditions, but when those conditions are present, such as Aspergers Syndrome, they often take treatment the priority. Just to bear in mind, like anything else, there is no cure for Tourette's and no medication that works universally for all individuals without significant adverse effects. Clonidine, or the clonidine patch, is one of the medications typically tried first when medication is needed for Tourette's, however. Haloperidol is an antipsychotic medication sometimes used to treat severe cases of Tourette's. Medication is available to help when symptoms interfere with functioning. Some of the also other ones that I've heard about also for the treatment of certain medications is that some people may use some form of ones that are recommended through ADHD users of certain things, or Ritalin and the like, but sometimes some people have said there's no harming effect, but then again, who knows. But this quickly ends briefly, hopefully, the information about Tourette's and difference between it all. Hopefully you've learned something along the way. Give me a like for thumbs up for support. Comment below if you've got Tourette's syndrome and maybe feel like to share your story about how you manage it. Feel free to also share these videos around so that we can educate one another and learn more from one another. And all for today, guys. Thanks for the support. Thanks for watching. Don't forget to turn on the notification bell, and also subscribe to my channel for weekly updates or even daily updates of what I've been up to. So no further ado, guys, thanks for the support, thanks for watching. Do what you love what you do. Until next time, Aspie signing out. Ciao for now.